Well, good evening and welcome to tonight's virtual Montgomery County Council's Town Hall. We hope that everyone had a safe and restful Thanksgiving. I'm Sidney Katz, the Montgomery County Council President, until tomorrow when we elect a new president for the year. I'm the District Council member for the 3rd District. The 3rd District includes all of the cities of Rockville and Gaithersburg, the town of Washington Grove, and parts of Aspen Hill, Durwood, Redland, parts of North Potomac and parts of Potomac, and all of Leisure World. I'm the chair of the Public Safety Committee, and I serve on the Government Operations Committee. I always look forward to these meetings because they provide us with valuable insights about the needs and concerns of our residents. As I close out my year as president of the council, and as we all look toward the end of a challenging year for our community, our state, and our nation, it is more important than ever before you to let us know about the issues impacting your daily lives and to learn more about the resources that are available. I want to thank our special guests who have also made time to join us tonight. Board of Education President Shebra Evans, Superintendent of Schools Dr. Jack Smith, Dr. Kahad Dumian, the new director of the universities at Shady Grove, County Public Health Officer and Chief of Public Health Services, Dr. Travis Gales, and Director of the Office of Emergency Management and Homeland Security, Dr. Earl Stoddard. Senior Communications Specialist Susan Kennedy is moderating tonight's discussion through a Zoom webinar. She will move between live speakers and those who send in their questions through the Q&A feature. Please keep your questions to no more than 2 minutes so we can get to as many individuals as possible. If we do not cover your question tonight, council staff will follow up with a response following the meeting. I also want to welcome Diane Lavoie, who will be providing interpretation services along with Lillian Mayes. Tonight's virtual town hall is broadcast on County Cable Montgomery and is streaming on the council's YouTube and Facebook pages. With that, I want to turn it over to my council colleagues for introductions, and then we will move to our special guests. We will start with Council Vice President Tom Hucker.
Well, thank you, Mr. President. Thank you all for joining us tonight. I'm really eager to get started and hear the discussion. My name is Tom Hucker. I represent the eastern side of the county, District 5 from Tacoma Park, Silver Spring, White Oak, and Burtonsville. I chair the Transportation and Environment Committee, and I serve on the Public Safety Committee as well. I've always really believed we make much better policy when we hear the lived experience from the public. So I'm grateful that we have the leadership of our school system and our HHS department with us today, and I'm really looking forward to hearing how they're dealing with the challenges that have been in front of us. They've been doing a great job dealing with this all summer and fall, and I'm eager to hear your feedback. Thank you, Mr. President.
Thank you. Councilmember Gabe Albornoz.
Well, thank you, Mr. President. And although we will give you most of the accolades tomorrow, I just want to express my appreciation to you, sir, for shepherding us through this very challenging year. And also want to thank our colleagues and friends from the Board of Education on this call, and Dr. Gales and Dr. Stoddard, who have been working around the clock, even before the pandemic, but significantly more since then. As the Council President said, my name is Gabe Albornoz. I'm one of the 4 at-large members of the Council in the 2nd year of my first term. I have the honor of serving as chair of the Health and Human Services Committee and also serve on the Public Safety Committee as well. And I look forward to getting into it tonight, answering your questions and having a thoughtful discussion. Thanks so much.
Thank you. Councilmember Andrew Friedson.
Thank you, Council President. Echo the accolades for your leadership over the course of the year. Appreciate all of our special guests for joining us today and for your partnership through these challenging and unprecedented times. I'm Andrew Friedson. I have the privilege of representing the western part of the county, from the Potomac River to the railroad, from the DC line to the Frederick County line. And I serve on the Government Operations and Fiscal Policy Committee and the Planning, Housing, and Economic Development Committee. And I have the great privilege of being the council's lead for our terrific parks system, which have become increasingly more important during this incredibly challenging time for exercise and for stress release and for all of the other aspects that nature has played. Look forward to hearing your questions tonight, and very much appreciate the opportunity to hear from you.
Thank you. Councilmember Evan Glass.
Thank you, Mr. President, and thank everybody for joining us this evening. I'm Evan Glass. I'm one of your 4 at-large members of the council. I serve on the Transportation and Environment Committee and also the Health and Human Services Committee, where I'm the council's lead on issues related to homelessness and vulnerable communities. My colleagues and I have been working really hard over the last 9 months, making sure everybody is housed and making sure that everybody, especially the least fortunate in our community, are taken care of during these health and economic crises. So thank you for joining us this evening.
Thank you. Councilmember Will Jawando.
Thank you, Mr. President. Say that at least a couple more times tonight. Very thankful for your year of leadership. I'm Councilmember Will Jawando. I'm an at-large member of the council. One of 4. We represent the whole county. Born and raised in Silver Spring, the Long Branch area. And I serve on the Education and Culture Committee, where I'm lead for libraries, and on the Planning, Housing, and Economic Development Committee. Really excited to hear from everybody and look forward to what you have to say. Thank you.
Thank you. Councilmember Nancy Navarro.
Thank you very much, Mr. President, and welcome everybody. It is an honor and a privilege to be here with you, surrounded by this extraordinary team that has been working around the clock since March when all of this started. And as has been said before, we have to thank our council president for leading us through this year. And I want to thank also President Evans from the Board of Education for also leading everybody through this extraordinary time. As you will probably hear from Dr. Gales, Dr. Starter, Dr. Smith, etc., a lot is happening, and we still have a lot more things to address as we're now nearing this, or we're in the middle of the second wave. I represent District 4. And District 4 spans all the way from Wheaton. It covers Kent Mill, Colesville, Aspen Hill. It goes all the way to Olney. And I've been on the County Council since 2009. I chaired the Government Operations and Fiscal Policy Committee, and I serve on the Education and Culture Committee that is chaired by Councilmember Rice. It is, again, an honor and privilege to serve you, and I look forward to the conversation and the questions. Thank you.
Thank you. Councilmember Craig Rice.
Thank you very much, Councilmember Craig Rice. I chair our Education and Culture Committee and am a member of our Health and Human Services Committee. I represent District 2, which is the northern and central part of Montgomery County, right in the center, starting from North Potomac and Montgomery Village, going all the way up to the Frederick County line. And born and raised here in Montgomery County, very anxious to get to the questions, so I'll stop there.
Thank you. Councilmember Hans Remer.
Thank you, Mr. Council President. I'm Hans Remer. I'm one of the 4 at-large council members. I'm in my 3rd term on the County Council, and I chair the Planning, Housing, and Economic Development Committee, and I serve on the Transportation, Infrastructure, Energy, and Environment Committee. I've got 2 pieces of legislation, several pieces of legislation for the council right now, including one on farm solar and one on police officers in schools. Thank you.
Thank you. Board of Education President Shebra Evans.
Good evening. Good evening. It is such a pleasure to join you all after this Thanksgiving holiday. I hope you all had a lovely time spending with your families, although it was a bit different this year. We still have a lot to be thankful for. So just wanted to acknowledge you all. Thank you for having me. And I bring you greetings on behalf of my colleagues on the Board of Education. Similar to President Katz, I will soon be exiting out of my leadership role, but it's been great to be of service to the board the last 2 years as a president. So really looking forward to the questions that we will hear from our community. And just want everyone to know that the board shares the sense of urgency to have our students back in the buildings, but we also want to make certain that when we do get our students back in the buildings, that it's safe to do so. So just looking forward to all of the questions that we will hear from our community today. And just thank you again for having me.
Thank you. Superintendent Jack Smith.
Good evening. Thank you all for having me tonight. I appreciate the opportunity to share information and hear from our community. I also just want to say thank you to President Katz and all the members of the County Council for being responsive and nimble and flexible as we've tried to work through last spring's budget and through this fall through a variety of things up to and including this afternoon with the Education and Culture Committee. And really appreciate the collaborative work that gets done on behalf of more than 160,000 students in the school system. Thank you.
Thank you. Dr. Ann Kadamian, welcome to Montgomery County. Thank you, please.
Hi, everyone. Thank you so much, President Katz, and congratulations on your successful term. And it's so nice to see everybody. I want to say thank you to everybody for your leadership and compassion through these very difficult times. As a resident of Montgomery County, I'm very appreciative. I'm Ann Kadamian. I'm the new executive director of the universities at Shady Grove, trying to fill the very big shoes of Stu Edelstein. And I'm really excited to start working with all of you on some of the big K through 12 all the way through four-year university issues in Montgomery County, and just wanted to join you tonight, and if I can share any perspectives, I'm happy to do that, but just really appreciate the chance to be here and to start the conversations with all of you about how Shady Grove can play a role in workforce development, recovery, and the big K through 12 and up through four-year university pipeline challenges. So thank you so much for having me.
Thank you for joining us. Dr. Travis Gales.
Good evening, everyone. Pleasure to be with you. And I know we'll talk more in our meeting tomorrow, our briefing tomorrow, but happy to be able to answer the questions of our residents. Thank you.
Thank you. Dr. Earl Stoddard.
Good evening. I'm Dr. Earl Stoddard. I'm the director of the Montgomery County Office of Emergency Management and Homeland Security. Dr. Gales and I are here representing a whole cadre of folks, not just within county government, but across our nonprofit, healthcare infrastructure. While we've been playing a leadership role in this pandemic, obviously we're not alone in this, and I want to make sure that we give voice to all those people who are out there working every day to keep us all safe.
Thank you. And with that, we're going to turn to Susan Kennedy, who's the moderator for this evening and always does an extremely good job, makes it look easy, and I can tell you it's not, moderating for this event. So, Susan, please take it away.
Well, thank you very much, Mr. President. We do have some questions that are on the line, some folks who will be asking questions live, and we also see some questions coming in through the Q&A right now. So please, we have 60 attendees, and if any of you have any questions, please type those into the Q&A function, and we will direct them to the proper person who is here on the television show tonight to give you the answers. And our first question tonight comes from Paula Goldberg, and she will be on live asking her question.
Okay.
There you are. We can hear you. You can start your video.
I sent my question in.
Well, would you like to ask it on the air? We've got you as somebody who would be asking on the air.
No, I'd rather that you just read it.
Okay, we can do that for you.
Thank you.
Sure. Her question is, what arrangements are being made for Montgomery County residents to receive the COVID-19 vaccine when distribution decisions are made?
Well, I have a feeling that we'll be doing quite a bit of this today, but Dr. Gales or Dr. Stoddard, which one of you gentlemen would like to answer that question, please?
I'll take a first crack. So that's an excellent question that, interestingly, we're continuing to get more details as things move along. We have been planning at a local level, a regional level, and a state level since the summer to have an infrastructure in place. So once we do receive candidates that have been approved appropriately by the federal government as safe and efficacious, to be able to distribute those. Now, to level set expectations, though, I do want to be clear. The first two companies that have requested emergency use use authorization. Their hearings will happen in approximately 10 days. Once that decision is made and determination if they are safe to move forward, then the first batch, which is a small batch of those vaccines, will begin to be distributed from the federal level to states and then filtered down to the local level. Now, previously, before the candidates have moved forward, the National Academy of Medicine has laid out the criteria for the different priority groups. In the interest of time, I would recommend and send you to that as a reference point to get an understanding of how the priority groups have been defined and how they will be used to determine the strategies in terms of how it will be distributed. I will caution, we don't make those determinations at the local level. That is information that is provided to us from the federal level and the state level to help guide the distribution patterns. We are continuing to meet. Before this meeting, I was on a 2-hour call to talk about how those different groups will be defined. For example, when you're trying to make differences in the types of workers and the types of conditions that are considered to be higher risk versus lower risk conditions. So as we continue to get more information, as we move forward in that process, we will continue to update and provide that information to the general community. And the last thing I'll say, in terms of time, even if those vaccines do become available and do get approved, again, I want to level set expectations is that they will, as their production increases and we get more information, they will be disseminated over a period of time. So the expectation is that if we start that process in mid to late December, it will take at least 6 months before we're able to successfully roll that out to the general public later on next year.
Thank you.
I would only add, just 1 second, would be within public health and across emergency management, we've been working for years to do planning around points of dispensing, or pods, as we like to call them. And so our residents should take some comfort in the fact that this has been an effort, this kind of vaccine distribution has been a planning effort that we've undertaken for decades. And frankly, in 2010 with the H1N1 vaccine, we learned a lot of lessons that we can apply to this distribution when we're ready to take forward. So we've got a lot of work. We've got a lot of work ahead of us, but we've got a lot of experience in this area in planning and preparing to do it.
Thank you.
Very good. Before we go to our next question, however, I'd like to introduce Diana Lavoie, who is also here for interpretation. Lillian, would you please give instructions to our audience members who might need translation this evening?
Sure. Para las personas que están para hacer sus preguntas, tenemos una intérprete, ella es la señora Diane Lavoie. Si puede decir hola, Diane. Y ella va a estar aquí para traducir todas sus preguntas.
Muy bien. Gracias, gracias.
Thank you very much. Okay, now we're going to go to a question that's been sent in from one of our audience members. This comes from Scott Weber. This is a question for Dr. Gales. He says, virtual greetings to all. I have a question to Dr. Gales and all as to why large public gatherings by means of foreclosure auctions on the steps of the courthouse are still being allowed, contrary to the governor's executive order, the Court of Appeals administrative order, and the county executive's EO, which bans any such events without a specific letter of approval. He is from Bethesda, and he would like that question answered by Dr. Gales.
Well, I'll take a look into that. I'll confess I'm not aware of that specific situation that you're referencing, but we will take a look into that and provide the necessary guidance. And again, I think this is also a situation to make sure not to use this term too much, but to level set expectations, is that when there's things that you may see happening in public and you're not always aware of all of the details that's happening behind the scenes that go into those particular events and types of things. But we'll take a look into it, and if it's we find out information that is contrary to, as you mentioned, following the guidance, we will make sure to provide the appropriate guidance and halt those activities as appropriate.
Thank you, Dr. Gales. Our next question will be from Jared Kotler, who is in our audience live. And there he is.
Hi.
Hello, Mr. Cutler.
Hello. I typed my question. I'm actually forgetting what the exact question was. So if you could read it, that'd be great.
Oh, sure. Let me get to it here. Why are private schools being told to close, but bars and restaurants remain open?
Well, we have provided guidance to any school who's open at this point to provide our guidance based upon the guidance put forward by the Maryland Department of Education, as well as the CDC in terms of looking at measures of community transmission, including test positivity and cases per 100,000. By those guidelines, we have exceeded the capacity and threshold limits within which they recommend that schools be open. Now, the second part of your question does introduce an interesting point and has been discussed at great length recently by individuals such as Dr. Fauci, talking about if we are closing schools, what context do we have other aspects of our society and economy open? It's a very great question, and one that we continue to talk about and discuss, particularly as we move forward in this setting where we see elevated levels of community transmission. And I think moving forward, as we've continued to do so in terms of the guidance that we're providing from a health perspective, we have to start looking at those things in the context of if we want to, not if, but we all, because we all do, but in order to get the numbers down to a point that is low enough for us to feel comfortable for children and staff members to go back into school settings, we do have to have a serious, significant conversation about the types of restrictions that are in place and the types of practices that are still open during this time.
Thank you, Dr. Gales. Our next question comes from on the subject of mental health. And the question comes from a person who's wondering, how can we deal with mental health during this pandemic? It's a very general, basic question, but something that people are really dealing with, we know. Dr. Gales, anybody, some advice for us folks who are out there who are having difficulties?
I think at least from the health side, and I'd love to hear from others as well, I think part of it is continuing to stay connected, even in the setting where we are encouraging folks to physical distance from those outside of your household. So utilizing other platforms such as virtual and social media type platforms to stay connected to our family members. It's important to also continue to partake in activities that do bring you joy and some of your hobbies, again, within the setting of adhering to the public health guidelines. It's important to stay active, whether it's going for walks or running or utilizing other types of physical activity. And I think just continuing to enhance those mechanisms to increase our level of connectedness with folks, even if it's not in the real-time physical sense. And I know that colleagues in other areas within HHS and across other government agencies are continuing to explore different ideas in terms of being able to increase opportunities for connectedness. And we also continue to support those practices and platforms that have come to us and said, how can we, potentially leverage these events or do these types of things that will bring people together in some capacity in a safe manner. And so we continue as best as we can to try to provide guidance to ensure that those types of events are done safely, but also allow for that connectivity to help address the mental health concerns that people may have.
And I'm also going to turn to the chair of the Health and Human Services Committee for the Council, Councilmember Gabe Albornoz.
Well, thank you for that question. Recently, the HHS committee hosted the boards and commissions that represent all of the corresponding areas of expertise in the county, including aging, our disability community, a commission for our children, youth, and families, and across the board. Mental health was seen as a tremendous challenge, a huge issue, one that's growing. We've also heard from our frontline service workers and our medical personnel that are exhausted, that are feeling overwhelmed. Just not being able to see family members in the way that we normally are accustomed to during Thanksgiving, not being able to go to religious services in the way that we were before. this is just adding a tremendous burden and a tremendous sense of loss for so many different people. And we hear you. We know how dramatic that can be. And for those individuals that are in crisis, the county does have a county crisis line. It's 240-777-4000 that people are able to contact 24 hours a day, 7 days a week, if they need to speak to somebody immediately. But as Dr. Gale said, to the degree to which that we can connect to family and friends, even if it's virtually, to the degree to which we can exercise at home or go for walks, adhering to the guidelines, but still going out into the public. These are all steps that we all must take, and we all must look in the mirror at ourselves. In order for us to be able to help our friends and family, we have to take care of ourselves. And so it's a very important question. There is no easy solution or answer. And we also know that there are a lot of people who are facing tremendous economic despair too, with the number of people who have lost their jobs, the number of people who are facing eviction. And while the council has worked hard to put forward funds in partnership with the executive branch, we know that the need is growing. And so we're very sensitive to it, and we will continue to support the programs and services and organizations that are on the front lines addressing the tremendous needs of the community, which are growing every day.
Thank you.
Thank you. Our next question comes from the audience. Amaryllis Castellon will be on the air live with her question.
Pase y haga su pregunta, por favor, señorita Castellón, y si desea yo puedo traducirlo.
Amaryllis Castellón, es un momento de dar su testimonio.
Sí, buenas noches.
Yes, good evening.
Mi nombre es Amaryllis Castellón y resido en Silver Spring.
My name is Amaryllis Castellón and I live in Silver Spring.
El COVID-19 ha sido un verdadero reto para todos.
Pase y haga toda la presentación, señorita.
Actualmente somos muchos los que estamos pasando dificultades para poder salir adelante y el poder pagar la renta ha sido un verdadero reto. Aunque el condado ha brindado atención para el pago de renta, es importante que ustedes sepan que esta ayuda no está agilizando con prontitud. Hay gente esperando meses por una respuesta y nadie da seguimiento. Necesitamos ayuda para poder entender nuestros derechos como inquilinos y el respaldo del condado para que esto no sean violados. Necesitamos intermediarios activos para poder llegar a acuerdos con los dueños de viviendas que acosan y violan nuestros derechos.
COVID-19 has been a real challenge for us. Currently, there are many of us who are going through great difficulties in order to manage during this time and to be able to pay our rent. That has been a real challenge. Although here in the county has given us help for rental payments, what's important that you understand is that this help is not getting to us quickly, promptly. There are people waiting months for a response and nobody is following up. We need help in order to understand our rights as renters, and we need the support of the county to be able to ensure that these are not violated. Finally, we need intermediaries who are active and can reach agreements with the landlords that are harassing us and violating our rights. Thank you.
Thank you. We certainly have many programs that we're working on, but I'm concerned that you're not hearing directly from the county itself. Councilmember Glass, did you want to comment on, or in Council Vice President Hucker? But
Sure. Thank you, Mr. President. There are a number of programs and services that the Department of Health and Human Services and the Services to End and Prevent Homelessness are operating. The council and the county executive have allocated nearly $22 million in total for housing and rental assistance. And I know because of the incredible need and the communities that need that, we've been doing everything we can to make sure that those processes work quickly. I'm looking at Councilmember Navarro in my screen, and I know that she has been pushing so hard to make sure that language services are available, and it sounds like those services have not been made available to you, or that those responses, the response time has not been what it should be. And we need to do a better job, quite frankly. And so I know that I'll work with my colleagues in the county executive to make sure that that response time increases, but there are a number of programs to be able to get you and others who are facing rental insecurity between $4,000 and $6,000 to help with your monthly rent and even rental arrears, back rent that might be owed. And so please reach out to any of us and we will make a direct connection to make sure your application is being processed and that you and your family can safely stay in your home during this crisis.
Thank you.
Chairman Katz, would you like me to interpret any of that for you all?
Please.
Okay.
And in the meantime, go ahead and interpret, please. We're going to ask Council Vice President Hucker, and then he'll be followed by Councilmember Navarro.
Señorita Castellón, yo voy a hacer una interpretación en resumen de lo que se ha dicho. Se dice que hay muchos, se ha dicho que hay varios programas dedicados a los problemas que usted ha enumerado. Algunos del Departamento de Salud y Salubridad, otros dice que hay 22 millones que se han dedicado, presupuestado para los costos para apoyar el pago de rentas. Tenemos muchas necesidades, reconocemos que hay muchas necesidades para ayuda. Estamos haciendo todo lo posible para agilizar los procesos. Entendemos la necesidad de eso. También parece que usted no está escuchando directamente del Consejo, es decir, que no se le está llegando de una forma adecuada a usted. Y lamento mucho eso. Estamos ahora tratando de dirigir de $4,000 a $6,000 para asegurar por mes, para asegurar el pago de renta si fuera necesario. Y en todo esto le ruego, señorita, que usted se comunique con sus concejales aquí, cualquier de nosotros para ayudarles en estos asuntos. Eso es un resumen muy general de lo dicho.
Thank you, Council Vice President Hucker.
That was a lot, Diane. Very impressive. Amaris, I'm very glad your family applied for the rental assistance. I'm so sorry to hear about your troubles. I am happy to work with our housing department to advocate to your landlord to make sure those payments are applied correctly.
Me alegro mucho, señorita, que usted ha solicitado el apoyo en cuanto a la renta. Estoy muy dispuesto a asegurar que haya un intermediario que trabaje con el dueño de la vivienda para asegurar que estos pagos se dirigen adecuadamente para sus necesidades.
So if we could learn, if our staff can work with you to learn who your landlord is, I would be happy to contact your landlord.
Entonces, por favor, si nuestro personal puede comunicarse con usted y usted le puede dar la información acerca de quién es el dueño, nosotros yo con mucho gusto aseguraré que alguien trabaje con usted para resolver estos problemas.
And thank you. And other renters who are listening tonight should know that we have additional rental assistance available, and people should apply for it while it's available so we can make sure those payments are applied toward their rent while we still have the assistance available.
Para otros alquilinos que están escuchando esta sesión, por favor, entiendan que hay más fondos disponibles para el pago de ayuda en cuanto a a las rentas. Así que les ruego que hagan su solicitud, su aplicación para tales fondos tan como todavía los hay.
Thank you.
Thank you. Councilmember Navarro, did you want to add?
I think my colleagues have done a great job in explaining. I would only say a la señora Castillo, muchas gracias por venir esta noche y compartir. Ya le han dado muy buena información, comuníquese con nosotros. Thank you.
Thank you.
Thank you.
Susan.
Our next question comes from the audience. Sharon Bauer will be live asking her question. Ms. Bauer? Are you there, Ms. Bauer? Can you hear us?
I am. How are you?
Good, thank you. You may go ahead and ask your question.
My question was relating to the impact of how are we going to pay for these programs with the lack of, with the CARES, once the CARES money runs out, how are we going to pay for all the programs that are on, that everyone is suggesting that we go forward with?
Well, that's an extremely good question, Ms. Bauer. Obviously, the council does have a budget. The CARES money, hopefully we will be getting additional CARES money from the federal government. But I'm a person that understands that the only money you count is the money that you have. So we're not counting on additional funds. We're hoping we will get them, but we're not counting on them. And we will certainly have to live within our budgetary system. And our last budget was a very tough budget. It was a continuity of services budget. We did everything we could to keep our services in Montgomery County without raising taxes, which we did not do. And so we will have to use our method to see how we can move forward. But at this point, the CARES money has to be spent by December 31st, and then hopefully the federal government will be of a greater assistance. But at this point, we're not counting on it.
Okay, we're going to shift gears.
Councilmember Navarro, who's the chair of the Government Operations Committee, please.
Thank you, Mr. President. Yes, Ms. Bauer, thank you so much for that question. As Council President stated, we have been proactive. The minute that we realized that we were facing this pandemic, which was in March, which is when we received the budget proposal from the executive, we immediately retooled to adopt a budget that was continuity of operations, meaning that we would only add money to those things that were COVID-19 related. And it was a tough decision because we had to forego raises for our employees, for example. We did not raise taxes because we understand that this is a very difficult time all around. And we ensured that we just adopted the money necessary to continue the services that our constituents, our residents expect. Now, it is true that we are not sure what's going to happen to the federal funding after the CARES Act expires. We're hoping that there would be that recognition. The local jurisdictions are being hit very, very hard. But another thing that we have to also, share is that the leadership of this county has been working diligently to ensure that we have a healthy reserve. And reserves are for emergency situations. And if we get to a point where we realize that this emergency is continuing to a degree that is really affecting the social fabric of our community, that it is something that we can definitely consider. And I think that speaks volumes in terms of the proactive work that has taken place in this county for years, starting with the last recession, for us to make sure that we would have a healthy fiscal environment. And having that reserve at a 10% level is an important safeguard, but we will do everything possible to continue to be very, very fiscally mindful and only spend money when it's absolutely necessary to mitigate this horrible impact on our small businesses and also on very many vulnerable residents in our community.
Thank you. Councilmember Jawando.
Thank you. And I just want to add briefly, I was going to mention the reserve, that Councilmember Navarro took care of that. I totally agree on that. We are in a fortunate position thanks to previous decisions. And this is another term for reserve is rainy day fund. And certainly it's been raining in 2020, if not a monsoon. I think the other thing, we just had an Education and Culture Committee meeting today, and one of the things I said, and we talked about, for example, when we have President Evans and Superintendent Smith here, is that there are things that we don't know that we even have to pay for yet to re-enter school, and the challenges that are facing our communities. So I think we all have to, and then the unequalness and inequitable nature of this recovery, the most unequal ever. Some people are actually thriving and making more money, and others are really, really suffering. So I think we're going to have to look at a whole range of things, not just now, but for the next several years, and certainly working with our federal and state partners, and then having everything on the table here to make sure that we take care of everyone here in Montgomery County. And that's one of the great things about this county is we have that ethos to take care of our neighbors. And so whether it's through federal, state partners, reserves, or looking at the need to raise additional revenue and take care of our residents here through county population supporting, I think all of that's going to have to be looked at in the coming months and years to get out of this recovery in an equitable and prosperous way for everybody. So I just wanted to mention that. But thank you for the thoughtful question.
Thank you. Susan, next question, please.
We are going to shift gears just a little bit. We have a few questions on the education front. First, we will hear from Mercedes Sorto.
Mercedes Sorto es su momento de hablar.
Adelante, señora Mercedes Sorto. Haga su testimonio y yo lo traduzco.
Ella está hablando pero no se oye y ya ella le quitó el mute. Is it a host issue? Because I see she doesn't have her mute microphone, but you can't hear her.
Señorita Sorto is unmuted, so it may be on her end, but I'll work with her on the side with that.
We go to the next person and come.
Yes, why don't we go ahead and take Jill Gay while we're trying to get that question sorted out. Ms. Gay, you are up to ask your question.
Hi, thanks. I have a question both for Dr. Gales and for the head of the Board of Education and those involved in education. I'll start with Dr. Gales. My question is, can we get vaccinated will we be getting vaccinated through our health insurance if we have health insurance, or are you trying to set up a different system? My question for the Board of Education is, what are you going to be doing to improve the way U.S. history is taught in high school to further the cause of racial justice? I was pretty horrified. My kids, obviously I'm old and my kids are no longer in school, but a friend of mine, was in 11th grade last year, and his textbook was atrocious. It was so racist. I started reading it and I was like, I don't even know how you manage with a textbook like that. So I'd like to hear a response. I can look up and put in the chat or the question what the name of the textbook was, but he was at Blair. He's now a senior, so it was last year. He was at Blair in 11th grade U.S. history. Thanks. Over and out.
I'll just briefly mention for the vaccine question. So Ms. Gate, this is one of the areas, as I said, as we develop more details in terms of the distribution strategy, we'll make those public. At least in the early phases, the distribution will be through a system of what we call closed pod events that will be specific for those who fit the criteria for those early priority groups. Now, as the distribution moves forward and as it opens up to larger segments of the community, and it becomes more available to be distributed through different resources, whether it's through the county apparatus, through pharmacies, or through private providers, then those specific details related to insurance status will be will be detailed and rolled out. But at least in the early stages, it will be a controlled distribution that is overseen by the state and the local health department. And again, as we get those specific details, we will roll those out to make sure that you and the rest of the residents have access to it and understand how that will be distributed evenly and fairly.
And I can share that in the school system, in 2018, we adopted new pre-K through 8th grade mathematics and language arts curricula. And this past spring, we engaged in K-12 social studies review. And so the entire curriculum is being reviewed, as well as all instructional materials. I will specifically go back and look and see what book was used at Blair last year in the 11th grade with U.S. history based on your comments. But I do assure you that we are reviewing all social studies curriculum. Our efforts around language arts and math at the elementary and middle school were to create a more inclusive curriculum, a curriculum that better represents the children we serve and the families we serve in the community. And we're doing exactly the same sort of work right now around the social studies curriculum.
Okay, let's check back with Ms. Sorto and see if she's been able to sort out the issue with her audio.
Señorita Sorto, ¿usted puede hacer su testimonio ahora?
In case it doesn't work, she did submit her question, so I could read it.
Great.
Mercedes, ¿quiere probar hacer su pregunta? Well, it seems like it doesn't work. So let me read it for you. Buenas noches, mi nombre es Mercedes Sorto y vivo en el área de Silver Spring. Tengo 2 hijos. El mayor nació en El Salvador y el que le sigue aquí en Estados Unidos. Mi hijo menor ha sido diagnosticado con autismo y aunque mi presentimiento de madre dice que mi hijo mayor también tiene autismo, no lo puedo saber porque no hay recursos para él por no ser ciudadano americano. Necesito que me ayuden para que las escuelas y el condado de Montgomery en general incrementen sus recursos para asistir a personas con discapacidades independientemente de su estatus migratorio. Necesito que me den ayuda y que examinen a mi hijo mayor.
I can run through a translation real quick. Good evening. My name is Mercedes Sorto. I live in Silver Spring. I have 2 children, two sons. The older one was born in El Salvador, and the following one here in the United States. My younger son has been diagnosed with autism. And although my motherly instinct tells me that my older son also has autism, I'm not able to know that because there are no resources for him to be tested because he's not a U.S. citizen. I need help so that the schools in Montgomery County and in general increase their resources to help people with disabilities independently of their immigration status. I need help so that my older son can be examined. Thank you.
So yes, so we will get your name and contact information through this television program that's being created right now, and someone will reach out to you this week because immigration status is not necessary or even part of anything that we are involved with in the school system, and so your son should be able to be assessed and receive the services he needs. So I will have someone contact you this week and reach out to you so that we can get that started right away, that assessment. So immigration status, we do not involve ourselves in immigration status. We know nothing about anyone's immigration status. And so we serve children and we want to serve your son. So we'll take care of that this week.
Sí, la respuesta es sí, absolutamente. Obtendremos su nombre e información para comunicarnos con usted. Esta semana alguien se comunicará con usted para dirigirse a este problema. Le aseguro que la situación, el estatus migratorio no tiene nada que ver con estos recursos. Nadie debe ser negado estos recursos por causa de su situación migratoria.
Thank you. Susan, you're on mute.
Thank you. Our next question comes from Kat Harper. She's in the audience. Ms. Harper, I know you had several different questions, and we've put you in the queue here to ask your question about education.
Okay, yeah. So my question in regards to education was the school closures don't seem to be supported by the latest CDC data. I know that Robert Redfield has said on several occasions that schools are not a primary source of transmission for COVID-19. And if we're able to have liquor stores and grocery stores and other venues open, then it would seem that schools should also be a priority, especially given the stance of the CDC on that.
Thank you.
Dr. Gales or Dr. Stoddard?
I would just mention, thank you for that feedback and that the reference to Dr. Redfield's comments. But I would also recommend that, again, the decision that the guidance that we provided from public health has been informed by the CDC guidelines that put in delineations about what are the safe levels of community transmission to guide that information, as well as by the State Department of Education that talked about the parameters of test positivity as well as community transmission levels based upon case rates. And so based upon those documents that were put into place, that were guided by the evidence that they had, that has been put out, and they've not retracted that or submitted any updated version of that, is the basis for the guidance that we've put forward to help inform both the non-public and the public schools. And I would also say that, as I mentioned in one of the first questions, is there is some, you're right, we do have to have a conversation about what types of other activities are permitted to happen while schools are closed, particularly if our goal is, not if, but again, supporting our goal to drive community transmission levels down. So I don't disagree with you on that, and I know that we're continuing to have those discussions. We will continue to have those discussions as we move forward, because ultimately, at the end of the day, in addition to the quantitative information that has been guided by the guidelines that I have referenced, we also have seen qualitative information that suggests that a lot of those studies that were conducted that say that, schools are safe environments, were done at much lower levels of community transmission. And if you think back to where we were in the spring, where we had comparable levels of community transmission to where we are right now, and in fact, the levels we have are higher than where we were in the spring, everything was closed down. So our points of reference are limited in being able to make those comparisons. But in summary, I would say that, the last part of your question is something very much to consider. And I know that lots of jurisdictions are looking at balancing how to drive down the level of community transmission to reach those parameters that have been put forward by the federal government as well as our State Department of Education, so that we can reopen schools safely.
And I would just like to say that we confer with not only Dr. Gales and Dr. Stoddard on multiple times each week, but we also confer with the team from the Maryland Department of Health and the acting deputy secretary at least once a week. We talk with her, as well as the state superintendent and representatives from the governor's office, all of those people coming together. And so we're listening to lots of voices and working closely with our local experts, as well as those folks at the state who are responsible for state health, and looking at every aspect of it. And there's nothing we'd like to do more than open schools right now. That's our business. At the same time, we have a responsibility to our students, their families, who they would potentially transmit to, and to all of our staff. And so we will continue to look for every opportunity to bring students back in schools, as Ms. Evans said earlier, when it is safe and appropriate, and as quickly as possible.
Councilmember Reamer. Thank you, Dr. Smith.
Thank you. I wanted to say in the spring, when we closed the schools, it had a very powerful effect to get the message out that everything had to change, that everybody had to stop what they're doing. And this was a drastic emergency measure that got people's attention. It got them to change their behavior. It wasn't just that children were no longer gathering in schools and parents were gathering proximate to schools, but it was that we were taking a step that was so profound that it carried through into other parts of people's lives. And I think that's why it had a big effect. One of the difficult issues here is that the data is coming in real time. And we don't have, well, every day we learn a little bit more. And I do think we have to be open-minded about what this fall's openings around the country will show and what impact that has on transmission. The reason why we've had the schools closed is a belief that opening them would cause the virus to spike in the community. It would put the parents and family at risk, and the teachers and the educators. So I think now we have a chance to assess what has actually happened around the country and keep thinking and keep working on this. Nothing, I think, is set in stone. I think we should always look at the evidence and keep learning and hearing from our experts. Thanks.
Thank you. Susan, next question, please.
Thank you. Our next question comes from Sharon Bauer. She will be asking her question live as well.
Hi there. I thought I already answered it.
Yes. Ms. Bauer had asked her question.
Okay, we got to. Okay, Michael English is next, and he
Thank you,
will
Ms.
also
Bauer.
be asking his question live. Thank you, Mr. English.
Hello?
Hello.
Hello, yeah, trying to start the video. It's not cooperating. Hold on one second. My video is acting up, but can you hear me? I'll just go ahead by audio.
Yeah, go right ahead, sir.
Thank you. And I'll apologize in advance. This is going to be a little repetitive to an earlier question. But on rental assistance, thanks for what the county's doing on that. I think it's helpful. The federal moratorium that was limited already from CDC is expiring. There's other protections. I understand some of this may have already been answered in the previous question, but to what extent is the county ready to, whether it's reaching out to lenders, to work with landlords, or to provide some sort of strict eviction protection, helping might be in dire straits, just from a public health standpoint and being a decent human being standpoint? I don't think we want to throw people out in the street in the winter during a pandemic. So be curious as to those options.
Thank you. We did answer most of that, but I'm going to turn back to Councilmember Glass, please.
Well, thank you, Mr. President. Thank you, Mike, for your question. You know, some of the things that you allude to, I wish we could do in Montgomery County, but we don't have the statutory authority to do so. You know, quite frankly, to appeal to lenders, to appeal to other types of landlords, or institute some things that we see in other jurisdictions around the country. That's why over the last number of months, we have seen some of our state legislators appealing to Governor Hogan, who has quite a lot of authority in this realm to protect renters and to institute other types of policies. But I know that a number of my colleagues have put forth some proposals that we've supported here. And you know, ultimately for me and all of us, we want to make sure everybody is safely housed during this crisis, and we'll do what we can, what we are statutorily allowed to do to make sure people are safe in their homes for the remainder of this situation.
Thank you, Councilmember Reno.
Thank you. Michael, thanks for the question. I just wanted to add, we have funded programs to provide tenants with counsel about their rights. And under state law especially, but there's federal as well, tenants have maybe more rights than they are aware, at least during the state of emergency. So we do need the governor to continue to extend that out, but we are also acting to put our CARES and our local money into programs that can directly work with tenants so that they understand, generally speaking, it's, you shouldn't be evicted for non-payment at this time. And tenants have a number of rights that they can assert. So I think that will continue to be a programmatic strategy for us.
Thank you. Ms. Kennedy, the next question, please.
We have a question from audience member Eric Rosen, who will be asking his question live as well. I believe he also has a question on the schools, hopefully along the different lines than the ones we've already asked. Mr. Rosen, go right ahead.
Thank you so much, Susan, and thank you to all of you for your service. And I apologize for being a bit repetitive, but as a parent of two BCC students, Dr. Smith, Dr. Gales, and Councilmember Reimberg, I have to say, our kids have been out of these classrooms for 9 months. We're looking up and down the East Coast at public school systems bigger than Montgomery counties that are safely reopening. We're seeing statistics that kids are not transmitting virus in the schools. And what we're seeing as a parent body is an inability of this council and this Board of Education to look at creative solutions to reopen our schools. And I am sorry to be so adamant about this, and I recognize everyone's service and the focus on public health, but you all need to understand the tragedy that is happening with our students who have been out of their classrooms for 9 months and in their basements and staring at their laptops while we're considering the relative risk of this virus. Please, please, I implore you, measure the risk of what is happening to our kids versus the relative risk that we all are learning more about for our students. And Dr. Smith, I appreciate the school system you run, and Councilmember Reamer, I really appreciate your role here. And to all of you, your service is challenging. But Dr. Gales, we all know that the metrics that you have set and the interpretation of the CDC guidelines that you have enunciated will mean, for sure, our kids will not go back to school during 2021, to the classroom. And that is a tragedy that this council has to recognize. Thank you.
So I would like to start and respond. I certainly understand, Mr. Rosen, your angst. We absolutely want our students back in the school system. And ultimately, the Board of Education and I will keep working toward that. Right now, we have a lot of things on the table, and we just don't know where they're going to go in the coming weeks. And we're going to keep working toward it every day. I will share with you, though, on a national level, as of last week, the Burbio School Opening Tracker, which is a very solid set of data from across the country, and I will send it to the council members and we'll post it on our website, showed that just under 44% of all the kids in this country, all over the country, are in all virtual. About 35% are in all 5-day-a-week classes, and about 21% are in some sort of combination, virtual and in person. And so we look at this all the time. We talk about it, we work on it, and our goal is to get there as quickly and as appropriately as possible. And so I would certainly defer to Dr. Gales on how those metrics line up, but we look at it and watch everything, Ms. Evans and the other board members and I and all of the staff working together.
Okay.
Okay, we have a lot of questions here about the reopening of schools, and a lot of these are quite repetitive, things we've heard from other folks already that we have answered. I see Councilmember Albornoz has his hand up.
So first of all, I really think the questions. I have school-age children, and I know the emotional toll that all of this has taken on them, and we have means and we have support, and we are giving them a structure that unfortunately too many students in our school system don't have. And there is undeniably an impact that is reaching students that is hard to process and absorb right now. And I agree and appreciate with all of the comments of my colleagues. I understand, all of us do, just the tremendous sense of loss, the frustration, and all of us as parents are losing sleep wondering how this is going to impact our kids, not just academically, which is important, but emotionally as well. And so, but I want to say something that hasn't been said yet, and to underscore how unbelievably important it is to have a coherent and comprehensive federal response to this pandemic, because we in Montgomery County are wrestling with this. We are looking at the data. So are our colleagues in Northern Virginia. So are our colleagues in the District of Columbia. So are our colleagues in counties across the state. And while we are working collaboratively on a number of different levels, because we haven't had a coherent, coordinated response and coherent and coordinated leadership, each jurisdiction based on the incredible knowledge and depth and education of our public health officials, are working as best we can with the information we have. But I've already started to see evidence, many of us have, just in the last 2 weeks, with the transition team that has been formed and the priority that will be set by our partners at the federal level, who I believe won't just help provide direction, but will also provide additional resources that all of us will be able to utilize, so that in addition to all the steps that we're taking at the local level, and yes, undeniably, we have to own that we have to take those steps at the local level. That kind of coordinated response, I think, is what is going to push us over the goal line and get us to a point that we all know we have to be in as soon as possible. In the HHS committee, we've been hearing story after story about the emotional toll that this is taking on students. We know it, we feel it, and we know our friends in the Board of Education are getting emails and correspondence and feeling this every day. And I know Dr. Smith has just lost, I can't even imagine how much sleep you've lost, sir, thinking about all of this and trying to process it. So it's a very complex issue on so many different levels. And we also haven't talked about the impact on teachers too, because the impact on teachers has been dramatic and overwhelming as well. So there are a tremendous amount of layers to this, but I think the help with the coordination of federal response is going to make a significant impact. And as Councilor Reamer said, we are all committed every day to looking at the information in real time and making adjustments as necessary so that we can all achieve our goal of getting students in the classroom as soon as humanly possible. Thank you.
Thank you.
Thank you, Councilmember Albornoz. Again, we do have a lot of questions about schools reopening. I want folks to know that their questions will be answered in some shape or form. We do get these questions when the meeting is over, and they are responded to by our staff. So your question will not go unanswered. But we do have a couple of other topics that we'd like to cover before we close out the meeting this evening. This question comes from an audience member. He is wondering, are hospitals ready to inoculate every employee, and when will they be ready to inoculate at-risk residents in their clinics? Obviously, we have a lot of talk going on right now, exciting news about the vaccine, many of which are being produced right here in Montgomery County. Does anybody have any information they can share on a timeline with this?
Well, I'll take a stab at it. Again, I would encourage folks and reference the National Academy of Medicine's website and a report that lays out the different priority groups and how the vaccine will be distributed through the population based upon those criteria. In the first wave, healthcare workers and healthcare providers are included, and hospitals are actively developing strategies to determine how and who will get those vaccines and in what order. And again, as we continue to move through the priority group continuum for different groups, the different strategies in terms of how they will be disseminated to those priority groups will be released and announced, again, heavily dependent upon, again, what the candidate vaccines will be, how they will be stored, and what the most effective way of distributing them to the community will be. I will say again that the early stages of vaccine dissemination for specific populations will be conducted in a closed pod method. And what we mean by that is, I think, a lot of people have visions of a large place where everybody drives through and gets a vaccine. That won't happen for some time. But, to the question, for example, healthcare workers, the vaccines would be distributed on site through their particular employer. And actively coming up with those strategies to determine who will get the first wave. Because again, the important thing to hammer home is that yes, they are becoming available, but we're not expecting there to be hundreds of millions of vaccine distributed on December 18th. There will be limited quantities, and as production ramps up, again, we'll continue to move through those priority groups. Ultimately, hopefully, in the span of a 4 to 6 month period, we'll be able to get to the point where hopefully early to mid-spring, we are able to start distributing the vaccine to the general public.
That's good news. We like that. Our next question comes from Charles Hendricks. He's in the audience. He asks, how will the council determine the boundaries of the new county council district lines needed after the 2020 census and the voters' decision to increase the number of districts to 7? Will municipalities in the county have a way to participate in the redistricting process?
Well, thank you for the question. We actually, this week, in fact, I can turn to Vice President Hucker. We're going to be interviewing for people for the redistricting committee, please.
Well, thank you, Mr. President. The good news is we had over 100 people apply to be serving on our redistricting commission. There are a lot of complicated questions in front of us. We haven't changed the structure of the council in 30 years, I believe it is. We are looking both at the internal and the external consequences of that vote. So I'm in dialogue with many of our colleagues, particularly the chair of the Government Operations Committee, to figure out how we go forward. But yeah, certainly we want to hear everyone's voice, and certainly we want to hear the voices out of our municipalities to make sure that we're doing the right thing as we move forward in determining those boundaries.
Thank you. We do have a follow-up question from Scott Weber. Dr. Gales, we spoke with him earlier in the meeting. He says, thank you. As a follow-up to the earlier foreclosure sale question, who within the Montgomery County government has the authority to declare such events unlawful and stop rush foreclosures that are in violation of the trio of orders? The courts have said that since they take place outside, that it is a county issue. 311 has no idea where to direct. The sheriff's office has no idea where to, no idea either. MCPD chief's office has no idea. Most of the conversations have said that it is a COVID restriction. The decision should probably come from the health department and HHS. Any contact information that we could possibly give him?
Well, I would say if there's a specific complaint or specific concern about a particular venue, to let our offices know and we can investigate that. There is a complaint process. Again, folks can file a complaint and we will have our staff investigate a particular event. And again, levy whatever guidance is appropriate with the particular situation. And unfortunately, I don't know of the specific situation that was referenced, and would want to do my due diligence to find out more information before answering in more depth.
Mr. Weber, you can file on the county's website, the site. There is a report of violation link that provides you a couple different options to report it. That'll come into the Licensure and Regulatory Division of HHS, very likely, and they'll do direct follow-up either through that office or in partnership. We have an enforcement team that works together collaboratively to follow up on these things. I will say, generally speaking, the courts have been pretty collaborative with us, and so obviously we'll follow up on this issue, but I would expect we could come to a resolution that works for everybody.
Thank you. Our next question comes from Dee Bartholomew. She is in the audience. She wants to know, how do you plan to handle the fallout from having children out of school for the year, specifically the increase in obesity, depression, and anxiety?
Well, we are engaged in lots and lots of things right now around this. And I wanted to answer earlier about the mental health question, and it moved on. Each school has a student well-being team, and we've had many thousand, up close to 10,000 referrals over the last many weeks since school started. And so we're trying to both respond in the moment right now, working with our health department colleagues and the medical professionals and everyone else. And we're also looking at how we can build out a plan for the next 2 years to really look at, as Craig Rice said at the beginning of this, and Will Jawando said, we had this discussion this afternoon at a committee meeting, the things we don't even know that are going to come up about this circumstance with students out of schools, families in this isolated circumstance, the disruption of parents' work. All of those things are going to have long-term effects. And so we're putting together a plan for the next couple of years that will look at intensive support for students around their social and psychological well-being, as well as their physical well-being. Also look at their academic needs, and how do we bring students back into physical spaces and into routines that they've been away from for so many months. It's going to be a really incredible challenge, and we're going to have to stay very focused, but also willing to adjust as new information and new understanding grows across what we've all been experiencing for the last almost 9 months now. And so if your child is struggling right now with something, call your principal, call your school counselor, call the central office. We have a support team in the central office that supports all the schools in the system, and say, I need some help from the school well-being team for this reason. We can't do everything, but we can do something to connect the family and the student to services in the community, or we have those services in the school, depending on what the nature of the question is. So please call us. We want to help.
Thank you. Councilmember Rice.
Just very quickly on that same note, I just want to make sure that the folks that are watching at home understand that the Kerwin Commission recommendations that came out over a year ago that the Governor Hogan vetoed would have actually provided additional mental health resources for our school system and for our school children. Wouldn't it have been great to have that now and be prepared for something like this that's upon us? And so now the General Assembly has the task of overturning that veto, making sure that those resources flow to local education associations across the state of Maryland. And so that will also provide additional resources for our students that's much needed when it comes to mental health counselors and support personnel in our schools to ensure the health, safety, and well-being of our children. And so I just want to remind folks to talk to their local state elected officials and remind them that they need to overturn the governor's veto of the Kerwin Commission recommendations that would do and treat the very things that are talked about in that question. It's really important, and I think we would be remiss if we didn't seize the opportunity to make sure that people are aware. Thank you.
Thank you, Councilmember Rice. Another question from our audience comes from a pediatrician for children from low-income and minority families in Montgomery County, and she is concerned about these students and helping them. And Councilmember Rice or somebody from the Education Committee might be able to talk a little bit about the equity hubs that are in place now for these kids.
Yeah, so let me just say, and I know we tried to answer some of that in the chat box as well, but we've stood up these education equity hubs in conjunction with the Black and Brown Coalition. So really want to thank them, both Diego Uriburu and Byron Johns, both from Identity and from NAACP, along with our Collaboration Council and the great work that they're doing. And then, of course, the support of the Montgomery County Council, my colleagues on the Education and Culture Committee, Councilmember Navarro and Councilmember Juando, and all of the council who supported this. We are standing up these education equity hubs to make sure that we're trying to allay some of the effects that we're seeing as a result of not being in class. We know that we can't change that by having these education equity hubs, but what we can do is mitigate some of the challenges that are associated by standing these up. And so these are in some of our most impacted neighborhoods throughout the county, in areas with very low socioeconomic status, and oftentimes in our communities of color. And they're primarily geared towards those students who are not performing, working in conjunction with our Montgomery County Public Schools to identify these students and making sure that they get the supports that are necessary. And so this is a great collaboration, again, for us trying to do what we can in the midst of this global pandemic, in the midst of the challenges that we see, understanding that we have to do something. We can't just say, well, we wish it could be better, but are actually taking action to provide support and resources to our children that need it the most.
Thank you, Councilmember Rice. I think this will probably be our last question, and it might be for Dr. Stoddard. This comes from Marissa Valeri. She wants to know, how can community and neighborhood associations work more closely with the county on getting information out on COVID-19 testing and safety measures? Recently, 20851 was top of the list on case positivity, and our community organization could be a valuable tool to quickly get folks to local pop-up testing clinics.
Sure, that would, I very much appreciate the question, very much appreciate the support. As the members of the council know that, we've talked a lot about communication and how we get information out to our diverse communities across the county and how much more we continue to need to do. So what I would encourage you to do, actually, I'm going to go ahead and say, just send me an email directly, earl.stoddard@montgomerycountymd.gov. We have a couple different venues that I think we could get you engaged in. We have a community recovery advisory group. And we also have a community organizations active in disasters, both of which we utilize to get information out and disseminate to our communities during COVID-19. I think there'll be a great venue to get you engaged, and you can contact me directly. We can get you involved through those avenues to help us get the message out. We very much appreciate the assistance.
Thank you, Dr. Stoddard. Council President Katz, I guess this is your last town hall. I'm going to turn it back to you to wrap it up for the evening.
Well, thank you very much, and thank you all for joining us this evening. I want to thank my council colleagues for their help in discussing all of these topics. And I know all of my council colleagues want to thank me in thanking President Evans and Dr. Smith and Dr. Gales and Dr. Stoddard for assisting us this evening as well. We want to thank Ms. Lavoie and Lillian Mayes, our tech team, which is not always an easy thing to do to get the technology working properly. And of course, we want to sincerely thank Susan Kennedy for doing such a superb job again this evening. You know, tonight we show that various government agencies need to come together and communicate in order to solve problems. That's what we did this evening. We came together, we are communicating. It does not end tonight, it will continue. And by all of us working together, we can get to a better place. So thank you all for being with us, and we look forward to the continued dialogue. Thank you.
For